what we're going to basically take a look at is key points that you can actually utilise for low back pain. And what we're talking about here is acute low back pain. So these points are specific for acute low back pain and have been shown in many research to be quite effective. These points are easy enough to locate. They're actually found at the base between the second and third metacarpal and also the fourth and fifth. Some literature will say between the fourth and third, but in most cases it's between the second and third and fourth and fifth at the base of the metacarpals. If you're going to look these points up, it's NU-E9 or EX-U-E7. So that's the numbering in which they'll actually give to describe these points. So that's if you're going to go on Google and do a search. But as I said, very effective points if you're going to actually utilise these. Now, these are used in conjunction with what you call movement therapy. So it's something where you actually either apply the needles and stimulate the needles while the patient actually moves and increases their joint range of motion, or you can actually get the patient to stimulate these points. I generally get the patients to go away after I've done acupuncture and maybe done a bit of soft tissue work, and then they can go away and stimulate these points. The beauty about these points is if you've got somebody coming in with acute back pain and you get them onto the couch and you watch them getting on and off that couch and watching them struggle, the beauty is you can keep them standing or you can sit them in a chair and put these points in along with other points such as the small intestine 3. Again, you can utilise this with movement therapy, stimulate the small intestine 3, stimulate these points on the back of the hand, and you get your patients to either bend forward and then bend back while stimulating these points, going over to the side and then going over to the other side. Now, this helps to loosen up the spine. And again, if you look at the studies, there's only about 2 or 3 studies on this, randomised controlled trials, but they're all showing very good positive effect utilising these points when compared with utilising other points and also when compared with other therapies. So best way to use them is alongside movement therapy. So any kind of stretching and combining these points, that's where you're going to get the best effect. Hope you find that useful.